What is prolonged exposure PTSD therapy? Have you ever wondered how therapy can help someone deal with the aftermath of trauma? Prolonged exposure therapy is a structured and evidence-based approach specifically designed to treat post-traumatic stress disorder. This therapy helps individuals gradually confront the memories, feelings, and situations related to their trauma that they have been avoiding. The main goal is to reduce the symptoms of PTSD by changing how the brain processes traumatic memories and the triggers associated with them. Prolonged exposure therapy includes two main types of exposure exercises. The first is called Imaginal exposure. In this part of the therapy, the individual recounts the traumatic event in detail during therapy sessions. By repeatedly telling the story, the intensity of the trauma memory decreases over time, along with the distress it causes. The second type is in Vivo exposure. Here, the individual gradually confronts real-life situations, places, or objects that reminded them of the trauma, but that are safe. This helps reduce avoidance behaviors and the fear linked to these reminders of trauma. In addition to these exposure exercises, PTSD therapy includes trauma processing. This is where the therapist assists the individual in reflecting on and contextualizing their trauma memory. Breathing retraining techniques are also taught to help manage anxiety and physical reactions during these exposure exercises. Typically, prolonged exposure therapy is delivered over 8 to 16 weekly sessions, each lasting about 60 to 90 minutes. It follows a standardized protocol to ensure consistency and effectiveness. Research shows that this therapy is highly effective in reducing PTSD symptoms with relatively low risk. While some individuals may feel temporary discomfort when facing difficult memories, this is generally manageable with support from the therapist. Now, let's talk about how this therapy can be accessed through telehealth. Prolonged exposure therapy can be effectively delivered remotely, allowing individuals to receive treatment safely and conveniently from their homes. Telehealth maintains the core components of PTSD therapy while offering flexibility and increased accessibility for those who may have difficulty attending in-person sessions. Overall, prolonged exposure therapy is a scientifically supported treatment for PTSD. It empowers individuals to regain control over their trauma-related memories and lessen the impact of trauma on their daily lives. It is crucial that this therapy is conducted by trained mental health professionals who can customize the approach to meet each person's unique needs and provide ongoing support throughout the process. If you or someone you know is struggling with PTSD, consider reaching out to a healthcare professional to explore this treatment option.